There are another set of procedures for the cervical spine that are very uncommon. I've mentioned elsewhere doing hydro dissection procedures. This is where we're placing needles into certain parts of the body and using jets of fluid to break or release adhesions that have occurred in places. This can happen with injuries, surgeries, infections, or just long-term abnormal inflammation throughout the body. When I say abnormal inflammation, I mean these are degenerative types of inflammation, not a healing type of inflammation, which is what occurs from regenerative agents. I've mentioned this patient previously. It's a patient that had 30 years of neck pain after several injuries. In addition to treating the entire stability and structure of the spine with other practitioners in a healing approach, she was left with some nerve issues that we were able to develop new procedures for to ameliorate. But then on top of that, she still had restrictions in her motion that didn't appear to be coming from pain. They were just restrictions in her muscles to be able to glide on each other normally, and they were to some degree entrapping the nerves of the brachial plexus that I've discussed earlier. With that particular patient, and there were 3 of them in a small grouping who needed very advanced neck care, I developed a muscle hydrodissection procedure where all of the fascial planes between muscles, you can think of them kind of like this. If this is muscle A and this is muscle B, you put in a needle into this plane using jets of fluid to open it up. Now, if you can imagine, having adhesions in that fascial plane will keep this from moving the way that it's supposed to. When those are freed, they'll be able to move very fluidly. Ubiquitously, when I do these procedures on individuals, they have significant improvement in their range of motion and comfort. There's a plus to doing this type of procedure when it's needed. I don't do it on every patient, usually the more advanced ones. Your nerves and your blood vessels actually live in these fascial planes usually. And if there's a lot of tension from these fascial planes, you're actually getting compression and irritation of nerves as well as blood vessels, and you're losing nerve function and blood flow. When we open up these planes, we're now able to get much more normal nerve function in other places, and this is a way that we treat nerves directly sometimes. Treating the muscles of the cervical spine as a regional combination can sometimes take care of the nerve problems in addition to the neck problems intrinsically.